Healthcare. Access to healthcare for older adults in the United States presents a complex and multifaceted challenge, weaving together issues of affordability, availability, and accessibility that profoundly impact the well-being of the nation's senior population. As individuals age, their healthcare needs naturally increase, encompassing a broader spectrum of services from routine checkups and chronic disease management to specialized geriatric care, long-term support, and end-of-life planning. While the United States has established several key programs aimed at addressing these needs, most notably Medicare, significant barriers remain that prevent many older adults from receiving the timely and comprehensive care they require. These obstacles are not uniform. They vary considerably based on geographic location, socioeconomic status, race, ethnicity, and the specific health conditions of the individual. Understanding these barriers is the first step toward developing effective solutions and ensuring that the healthcare system can adequately serve its aging demographic, promoting not just longevity, but also a higher quality of life in the later years. One of the most significant pillars supporting healthcare for older Americans is Medicare, the federal health insurance program for people aged 65 or older, as well as certain younger people with disabilities. Established in 1965, Medicare was a landmark achievement designed to provide a safety net for seniors, who often faced prohibitively high healthcare costs and difficulty obtaining private insurance. The program is divided into several parts, each covering different aspects of healthcare. Part A, often called hospital insurance, covers inpatient hospital stays, care in a skilled nursing facility, hospice care, and some home health care. Part B, or medical insurance, covers certain doctor's services, outpatient care, medical supplies, and preventive services. Together, Parts A and B are known as Original Medicare. However, Original Medicare does not cover all medical expenses, leading to the development of additional options. To fill the gaps left by Original Medicare, many beneficiaries enroll in supplemental plans. Medicare Part C, also known as Medicare Advantage, offers an alternative way to receive Medicare benefits through private insurance plans approved by the program. These plans are required to cover everything that Original Medicare covers, but often include additional benefits, such as dental, vision, hearing, and prescription drug coverage. Medicare Part D. Part D is the standalone prescription drug benefit available to everyone with Medicare, which helps to lower the costs of necessary medications. While this system of parts and plans provides a framework for coverage, its complexity can be a barrier in itself. Navigating the various enrollment periods, comparing dozens of private plan options, and understanding the intricate rules regarding coverage and cost sharing can be an overwhelming task for many older adults and their caregivers. This complexity often leads to seniors making suboptimal choices, either overpaying for unnecessary coverage or, more dangerously, finding themselves underinsured when a health crisis strikes. Despite the existence of Medicare, affordability remains a primary obstacle to accessing care for a substantial portion of the senior population. While Medicare covers a significant portion of healthcare costs, it is not free. Beneficiaries are responsible for premiums, deductibles, coinsurance, and copayments, which can accumulate to a substantial financial burden, especially for those living on fixed incomes. For instance, Original Medicare has no annual out-of-pocket maximum, meaning that in the case of a severe illness, an individual's financial liability can be limitless. This is a major reason why many opt for Medicare Advantage plans, which do have out-of-pocket maximums, or purchase Medigap supplemental insurance to cover these costs. However, the premiums for these private plans add another layer of expense. The cost of prescription drugs under Part D can also be a major strain, as beneficiaries may fall into the donut hole coverage gap, where they are required to pay a higher percentage of their medication costs out of. For low-income seniors, programs like Medicaid and Medicare savings programs can help cover these costs, but eligibility requirements and application processes can be difficult to navigate, leaving many eligible individuals without the support they need. Beyond the direct costs of insurance and services, the geographic distribution of healthcare resources creates significant disparities in access. This is particularly acute in rural areas of the United States, where a large number of older adults reside. Rural communities often face a critical shortage of healthcare providers, including primary care physicians, specialists, and mental health professionals. Hospitals in these areas have been closing at an alarming rate, forcing residents to travel long distances to receive even basic medical care. This travel itself presents a barrier for seniors who may no longer drive, lack reliable transportation, or have mobility issues. The lack of local access to specialized geriatric care is another pressing issue. Geriatricians, who are specifically trained to manage the complex health needs of older adults, are in short supply nationwide, and their practices are overwhelmingly concentrated in urban centers. This means that many older adults, especially those in rural and underserved areas, do not have access to a provider who can offer integrated, age-appropriate care, leading to fragmented treatment and poorer health outcomes. Furthermore, access to long-term care services and supports (LTSS) represents one of the most significant and often financially catastrophic gaps in the U.S. healthcare system for older adults. Medicare's coverage for long-term care is extremely limited. It primarily covers short-term post-acute care in a skilled nursing facility following a qualifying hospital stay, but it does not cover the custodial care that most people need for an extended period. Custodial care includes assistance with activities of daily living such as bathing, dressing, and eating. This type of care, whether delivered at home or in a nursing facility, can be extraordinarily expensive, with the median cost of a private room in a nursing home exceeding 6 figures annually. Most families are forced to pay for these services out of pocket until their life savings are depleted, at which point they may qualify for Medicaid, the nation's primary payer for long-term care. This spend-down process is a source of immense financial and emotional distress for families. The lack of a comprehensive and affordable long-term care financing system means that many older adults are unable to receive the support they need to live safely and with dignity as they age, placing an enormous burden on family caregivers. Social and systemic factors also play a critical role in determining healthcare access for older adults. Health literacy, the ability to obtain, process, and understand basic health information and services needed to make appropriate health decisions, is a significant challenge. The healthcare system is filled with complex terminology, confusing insurance forms, and complicated medication regimens. Older adults, particularly those with lower levels of education or cognitive decline, may struggle to understand their doctor's instructions, manage their conditions effectively, or advocate for their own needs. This can lead to medication errors, poor disease management, and a failure to seek necessary care. Additionally, social isolation and a lack of strong support networks can prevent seniors from accessing care. An older adult who lives alone without family or friends nearby may have no one to drive them to appointments, help them pick up prescriptions, or provide support during a health crisis. Digital literacy is also an emerging barrier. As healthcare increasingly moves online, with patient portals, telehealth appointments, and digital health monitoring, seniors who are not comfortable with technology may be left behind, unable to access these convenient and often essential services. Addressing the multifaceted challenges of healthcare access for older adults in the United States requires a comprehensive and coordinated approach. Policy efforts must focus on simplifying the Medicare system, making it easier for beneficiaries to understand their options and choose the plan that best meets their needs. Strengthening financial protections by capping out-of-pocket spending in original Medicare and expanding eligibility for low-income assistance programs would alleviate the significant cost burdens that prevent many seniors from seeking care. To combat geographic disparities, there is a critical need for investment in rural healthcare infrastructure and incentives to attract and retain healthcare professionals, including geriatric specialists, in underserved areas. The expansion of telehealth services, coupled with programs to improve digital literacy among seniors, can help bridge some of these geographic gaps, bringing care directly into people's homes. Finally, the nation must confront the looming crisis in long-term care. This requires a national conversation and bold policy solutions to create a sustainable and affordable system for financing long-term services and supports, whether through the creation of a public long-term care insurance program, tax incentives for private long-term care insurance, or expanded home and community-based service options under Medicaid. A solution is needed to protect older adults and their families from financial ruin. Ultimately, ensuring that all older Americans have access to high-quality, affordable health care is not just a matter of policy. It is a moral imperative. It reflects a society's commitment to honoring and caring for its elders, allowing them to live their later years with health, security, and dignity. Health care. Health care.